From WNYT Albany, News Channel 13 Midday begins right now.
Still ahead, making the Super Bowl a bit more earth-friendly, but first, keeping your heart healthy doesn't have to be a drag. Some useful heart health advice is coming up right after the break. Next month may be Heart Month, but keeping your heart healthy is a year-round proposition. Joining us now is Dr. William Cooper. He's a cardiovascular specialist, and he says that there are 3 keys to heart health. Hello, doctor.
Good morning, Elaine. How are you?
I'm fine. Okay, what are those 3 keys?
Well, the Life Supplemented campaign is about the 3 pillars of health, which are exercise, diet, and responsible use of supplements.
Okay, well, tell us what some of those supplements and tell us about the diet. Explain a little bit more.
Yes, of course. The supplements are very important and play an important role in overall health and wellness. And in fact, they are mainstream. 150 million people a year take supplements. We did a survey of cardiologists and found that almost 60% of them take supplements, and about 72% of them recommend them to their patients. So what are they recommending? Multivitamins, omega-3, fatty acids, vitamins B and C, and calcium. But it's important to recognize that it's not a decoupling or a replacement. These are exactly just what they say they are. Supplements are complements to an overall wellness plan, which includes exercise, which also includes a healthy diet, and also includes avoiding those unhealthy behaviors like cigarette smoking, stressful activities, and make sure that you get plenty of sleep.
About the supplements, doctor, do you take those if you know that you're not eating healthy, or do you, even if you eat greens and you eat all of your vegetables and those kinds of things, do you really need the supplements? Yeah,
I think that's a good question, and the answer to the question is absolutely yes, because the fact of the matter is, in general, most Americans don't get enough in their diet. In fact, it's very difficult with some of the recommendations to adhere to those strictly. For example, fiber, for example, we get about 10 to 15 grams of fiber a day. The actual recommendation for fiber is about 30 to 35 grams a day. So we do fall short, and I think the supplements play an important role in filling those gaps that we in fact miss throughout the day and over the course of a year.
Do you take supplements, doctor?
Absolutely, I do. I engage in all 3 pillars of health and wellness. I exercise about an hour a day. I begin early in the morning. I take my supplements, which include omega-3 fatty acid supplements. I take a fiber supplement as well as a multivitamin every day. And then throughout the course of the day, I try to watch the things that I'm eating. I try to be very careful with snacking on unhealthy things, going to the vending machines, the soft drinks, carbonated beverages, and those kinds of things. So absolutely, I practice what I preach.
That's a wonderful thing to know that you do, doctor. When you talk about exercise, you said an hour. Some people feel that that's just impossible. Is a half hour okay?
Oh, you bit right into it, Elaine. I love that. I mean, the recommendation is 30 minutes, 6 days a week. And let's look at this a little bit more closely and put it in a different light. 168 hours a week, okay? So what we need is about 3 of those hours for you to engage in some kind of vigorous physical activity. So it all equates to about less than 2% of your time. So the fact of the matter is you do have the time. You just have to commit to doing it.
Okay, doctor, we appreciate your perspective. Thanks so much.
Thank you, Elaine. Take care.
You too.